My name is Andrea Hobby, and I will be speaking with Barb about data careers and public health. You can follow the BlackTIDES Twitter account. You can tweet using the hashtag Black and Data Week 21. And let me talk a little bit about myself. So I started working in public health when I was an undergrad. You're fine, great. I started working in public health when I was in undergrad. I went to Wellesley, and I was pre-med in college, and I did lots of like public health and medical like internships while I was in school. So when I graduated from Wellesley, I was looking for like clinical or research positions so I could work while I was trying to get my applications together for medical school. But then eventually, after working with doctors for a while, I decided I didn't want to go to medical school. So I started looking for other things I could do in research that I might be interested in. So in this time period, I was holding jobs like research assistant and research coordinator. I ended up getting published, even though I wasn't interested in going to medical school anymore. And I learned through that process, I liked working with data. And also I learned while working for different research studies in like oncology and nephrology and just different areas of health that I liked working with the clinical data. So I started working on more clinical trials, and eventually I decided to become a data manager so I could work with data more. And during this time, I attended lots of lectures. I was working at UCLA at the time. I'm from California, and they have lots of like free lectures. You know, scientists always like to talk about their research, and I found out like some of the scientists in the lab I was working with were using machine learning to predict how different drugs they're developing were the immune system respond to them. And I thought that was kind of cool. So I was like, maybe I can learn that in school. So that's when I kind of decided to apply to graduate school. I'm not doing that now, but at least it got me interested. So I started learning Python, and I ended up learning SQL, and I got a job. I moved from California to DC to work at Georgetown, and I started working in transplant medicine as a data manager. And then I applied to grad school there and got in for my master's in epidemiology. So my job paid for it while I was there. And I studied epidemiology, and I made sure while I was there to do at least 2 research projects in different programming languages, just so I could learn new skills. So I did one research project from beginning to end using SAS, and one from beginning to end using R. So I had like something to talk about when I started to interview for jobs. So eventually, during grad school, I found a fellowship at FDA using mainly Tableau, which actually Tableau is something I taught myself while working as a data manager. Working as a clinical trial data manager does not require Tableau, but I just started using it as a part of my job just so I could start building up the skill set. And so I ended up using that at the FDA along with what I learned Python at the FDA. And then once I graduated in May, I had a job lined up because I went to Afrotech last year. And I was talking to recruiters, and one kept in touch with me, and they ended up hiring for epidemiologist at my current job, which is DSFederal Services. And that's kind of a summary of how I got to where I am now. And I guess to summarize everything, I just think for if you're interested in a data career in public health, make sure you understand the research process from beginning to end, because it's helpful to explain data and interpreting it in your job interviews. And just make sure even if you're not working as a data scientist yet, if you're working as a data manager or data analyst, you still can build those data skills to eventually get the job you want. And also just look at job descriptions of what you might be interested in and just learn those skills and those job descriptions. So eventually you'll get one of those jobs. And I think that's all I have to say for now.
Good. So my name is Barb Tisi. Like I said, my LinkedIn is on there. My journey started with, I have my Bachelor of Science in Medical Lab Science from the University of North Dakota. I worked in transfusion medicine for about 7 years after that. And then I got my master's in health informatics from the University of Washington. And I held a couple of roles after I got my master's, which I'll talk about in just a little bit. And then I also went ahead and got a data science certificate from a program I did with Correlation One. Some of the roles and positions I've held are been a public health data analyst consultant. I've been a health informaticist. I've been a course facilitator. I've been Epic systems analyst, and then I've done a bunch of consulting for some nonprofits, mostly public health related. And then some potential roles, I feel like public health into data science, like data analyst, data scientist, epidemiologist, product manager, business analyst. There's just so much I feel like you can do with data. And then also like sometimes the wording is difficult to like, sometimes you have a public health degree and you want to get into tech and you don't know how to. So these are just some positions like a public health advisor, machine learning, robotics, digital development. These roles I put on here, I feel like because medicine and technology is, getting advanced and constantly changing, definitely need people in public health in these tech roles. And I'm happy to answer any questions because like most people will ask me, how did you get started in data or in tech with your background in public health? So happy to answer any questions that people have about that. And then yeah, I guess we'll take questions whenever you're ready, but I think I'm going to talk a little bit about my roles. I feel like with a degree, so my master's degree is in health informatics, but it was in the School of Public Health. So I feel like just by virtue of having that master's degree in public health, I've gotten a lot of consultant roles or like contract roles or like projects that people were working on and then they needed like, like a subject matter expert to come in and help. So definitely my master's degree helped with that. You don't need a master's degree to get into data, but I felt like it was helpful. And then I did was facilitating a couple courses at my college, University of Washington, just because I wanted to see if teaching is something I'm interested in. And so, I just contacted the department that I, graduated from, and I was able to do a couple of, online classes. And then I realized that's not what I like to do. And then with like an Epic systems analyst, I wanted to combine my lab experience with like my data science experience. And, so I was able to do that. That's actually a software that most organizations, healthcare organizations used for like electronic health records in case anyone is not familiar with Epic. And then as a consultant for nonprofits, I feel like I got those roles based on, my master's in public health again. So, and then the most recent role I was in, I was a consultant for a project where they wanted someone who understood the data. I worked with some epidemiologists, and then they wanted someone who could do data visualizations for them. So I, was able to work on a project with them for a little bit. And that's actually, data is a passion of mine. I like, cleaning up the data. I know it's not always fun. I like to understand the data, and then I like to deliver the visuals and then, come up with maybe solutions or what we can do better. So with the data. So that's a little bit about me.
I have a question. Can you all hear me? Okay, thank you. My name is Tia Olande. I have a background in laboratory too, Barb, so that was interesting to hear you say that. I also have a master's in public health, and I'm transitioning over to data right now. Well, I should say I'm transitioning over to epidemiology. So I guess that's kind of what my question was. Do you all see out in the field if there's a huge difference in the data that data analysts need to know versus epidemiology, or does it overlap a lot? I'm currently working on a graduate certificate in epi, and so I noticed that I'm learning a lot of like the fundamentals of like statistics and stuff like that. But when it comes to data analysis, I'm learning like how to use the tools. And so can you kind of speak to what you kind of see as the difference between those two fields and how you can leverage your knowledge from being an epi into being a data analyst or vice versa?
Like I'm, I guess, kind of working in both roles right now. So I think first of all, it's really important just to be able to, do a regression analysis and be able to explain it. I took epidemiology. I did MS in epidemiology. Then I had to take statistics too. So I think, at least for my current job, where I'm the epidemiologist on the project, like being able to basically explain the concepts, like prevalence, incidence, mortality to non-healthcare people, and then also being able to do like logistic regression or linear regression and being able to explain that. And I think you can use that as a data analyst or an epidemiologist, but I think you just have to understand the fundamental concepts and be able to explain it. But I'm not sure if that answers your question, but if I can explain more, let me know.
Okay, yeah, that helped. Thank you.
So I'm going to speak a little bit on that too, Tia. Project I worked on was, there was an epidemiologist on there, and then it was a public health project looking at like, HIV AIDS data, understanding the patterns, analyzing all of that. So I got brought into the project because they wanted someone who could kind of help with the data, not just they wanted someone who would help with the data visualizations, which I learned I taught myself Tableau too, like Andrea did. I was in my data science program and I got an intro, and then I just, really liked it. And anyways, but the thing with data visualization, you have to understand your data. You can't just produce visuals, because you first have to understand your data, look for what you need in your data, and then create the visualizations and then explain the data, and also look at like project like what do you think could happen, like the regressions, all of that stuff. You need to know that. So it was really interesting when I was working with epidemiologists, because I felt like she had a very good understanding of what she was doing, like data wise. I think the only issue she was having was generating those visuals. But I did see a lot of overlap, because I have a degree in public health, not epi, but I saw a lot of overlap, and I saw a lot of, I think you need both. You can't just have one, depending on what project you're working on. You can't just have one or the other. And if you had just an epi, I feel like they would have to really understand the data, which when I did my data science certificate, I really got into. So they really do overlap a lot. And I feel like the project was so much easier to do when we had both of us in it. I most certainly couldn't do it alone. And I don't think she would have been able to do it alone. Obviously, that's why they brought me in to kind of help. But yes, they overlap a lot. You have to understand your data. You have to know how to explain it to people who are not in public health too. And also, Andrea did a podcast episode, and it's so funny because I was listening to it and I was like, wow, I didn't realize how much data and epidemiologists, like data science and epidemiologists, like really like overlap. So I learned a lot from that podcast episode. So I would totally recommend it to anyone who's interested.
What's the name of the podcast, Andrea?
It's the BlackTIDES podcast. Odane was the moderator.
Okay.
So,
Okay, I'll look that one up.
yeah,
Thank you.
so if you go to Spotify, it's the BlackTIDES podcast. I think it looks like Daisy has a question. And Odane was going to say something.
No, I was going to mention that I'll drop the podcast link in the chat for you, Tia, so it's easy for you to get to it.
Thank you.
Hi, I have a quick question. So I graduated with my MPH in Epi back in May, and I'm currently working as a data analyst, but then I'm also part of the DS4A cohort this fall. And I was kind of wondering, because I feel like I'm gonna know a lot of programs by the end of this. Do you recommend applying to positions that those programs are used, or just kind of applying and see if, so like I know R and SAS currently, and then I'm learning the 3 programs from the DS4A cohort. But I also know, like, I once applied to a position that didn't use languages. I was like, they were using the EPIC system and they were going to just teach it to me. So I don't know, should I just keep it like pretty straightforward when I start applying for like my next position, or should I just keep it broad and like what program that they have listed in the job description?
I would learn whatever makes you the most excited. I don't know. That's what I try to do. Like, if I see a job that I'm really interested in that requires R and Tableau, I'm just going to focus on that. And then hopefully I get it. Or if not, keep applying, look for jobs I'm interested in, and then figure out what to learn based on that.
I feel like you're in a really good position, Daisy, because it depends. I feel like in public health, they use a lot of R, but you're going to learn Python in DS4A. And if you know R, then Python is not going to be that hard. Or if you know Python, then R is not going to be that hard to learn. And like Andrea said, I guess it depends on what you're interested in. I see a bunch of roles in public health that more often than not, they ask for R, SAS, SQL, all of that. But like Andrea said, I would just learn as much as I can. I think the thing that gets data or tech can be really overwhelming. So I would find what I'm interested in and stick to that. There's always stuff coming up. There's always like a lot to learn. I would say to begin with, find something that you like, or find out what your interests are, or find a position, like just, search open positions and see what interests you and focus on that. Because if you try to do everything at once, you'll just get overwhelmed. But like, I love to learn, and I think it's a lifelong process. So I would focus on learning what they're teaching you in the program right now, get that down, and then afterwards, there's still a lot to learn. But once you know one of them, it gets easier. Once you know like a specific data visualization tool, I can only speak for Tableau and Power BI. That's what I'm familiar with. They're not the same, obviously, but it's easier to learn the other one when you know one of them. So I hope it gets easier for you, but it's gonna get overwhelming. Just focus on one thing at a time and then go from there.
So I see a question in the chat in regards to the difficulty in landing that first entry level position in healthcare data or in health data without an MPH. What are some good places to look if you have the healthcare domain and you're self-taught the data aspect of it?
I think like maybe like a research assistant or data analyst. I feel like those are usually like entry level roles. They don't require like a master's degree or anything. Or maybe like data manager.
I would
Oh, sorry. Go ahead.
no, I would also touch on similar to Barb's experience as an Epic analyst. You can use your healthcare background as a, let's say, a credential trainer, learn the system, and then express that you have this love for analytics or whatever the case is, and then you will be placed onto a healthcare analytics team. So that's also a segue into it.
Yeah, I totally agree. I did have a hard time finding a job after my master's. So my master's is in health informatics, and I feel like it's not as popular, even if health informatics is broad. So I did have a hard time finding a job right out of college because I knew what I wanted to do, and I wasn't finding like the roles that I wanted. I didn't have, like, they wanted some sort of programming, or like I wanted to get into analytics. But with health informatics, it was so broad. Like I learned cybersecurity in healthcare, data governance. Like it was so broad. So I think that's why I was struggling. And then that's why I decided to go get a certificate in data science so that I wasn't just focusing on just one programming language. That way I would still have more options, So for me, it was hard, but only because I knew what I wanted to do. I didn't want to do something broad, but I also didn't know. Sometimes the job titles can be they would be asking for like a public health advisor. And I'd be like, I don't know if I qualify for that. And then I would just read the requirements. And then I was like, oh, wait, I can totally do this, So I think it was really hard for me because I didn't understand how, the wording of the titles of, jobs the way they word those titles can be a bit confusing. So I just, would read what they're asking for, even if it doesn't seem like you qualify for it. But yeah, you don't need a master's degree. Another way is getting a certificate in whatever you're interested in, or even self-learning. There's a lot of programs now you can use, like Coursera. So yeah, you definitely don't need a master's degree. There's other ways to do it.
I will say, I'm in DC and I was at the FDA. I will say, if you want certain places, like the government, they're very into degrees, unfortunately. So one of the reasons why I left was because basically there's no way you're going to get promoted unless you have a PhD there. And I was like, I really don't want to do that right now. Even though I got into a program, I just didn't want to do it. So I left to work at a company where I'm getting paid the same amount as the epidemiologists at the FDA and all the federal government, but I only have a master's degree. So.
Hi guys. I just want to ask a question. I know you guys talked about certain entry level positions such as data analyst, and that sometimes they don't require that you have maybe a master's degree or something like that. But what do you do if you do for me, I am working on my PhD. And so I have a PhD this upcoming May, and I want to move more into the data role. I come from a public health background. I minored in statistics in my PhD. And so it's not heavy data. I work with data, and even in some of my side jobs, I work with data, but not having necessarily epi or biostats background. What do you suggest about moving into data where I could be considered overqualified if I do apply to an entry level job?
I think there are some programs that I know some people I went to school with that they had their PhDs and afterwards they decide they want to do data science. I think Insight, it's a data science fellowship program. They're more designed towards people that have PhDs. They're trying to switch into data science. So I would look for probably programs like that, or just do a certificate to help you switch into data science and to start doing projects.
I would even add to that, I could make the argument that if you have your PhD, you have a lot of research and data experience. So I would start applying for full-time data roles and leverage your education. You don't necessarily have to have previous job titles as a, let's say, an analyst or whatever the case is, but your degree speaks for itself. So you can use that as experience.
Yeah, and also I would say, really, I worked on a project where sadly, this person had their PhD and she was always the one doing all the administrative work, scheduling the meetings, taking the minutes, and all of that. And I was a bit confused because I was like, wow, I think she's overqualified for this. And she understood all the stuff we talk about because she was in public health. So I would say really be clear with where you're at. Do not just accept the position because it's a project. I mean, some of these projects, yeah, you as a consultant, yeah, you make a lot of money and it might seem oh my gosh, this is good, but no, you've gone to school for that long. So just really be clear with where your expectations are and really speak up and leverage your experience, like Odane said, because sometimes it's easy to just get lost in the sauce. So really just go back to what you did, especially maybe research, or I don't know what people in with their PhDs do, but really go back to your resume and really highlight all those things. And then when applying for roles, bring that in there. And I think you'll be surprised. I see a lot of people with the PhDs in data. So yeah, just really be clear on where you want to be from the beginning.
Thank
One,
you.
one question that I see in the chat is, are there any tips on how to get real world experience while completing any sort of data analytical program while working in a completely different field?
I'm like, let's see.
I would say do side projects. I mean, I went through a data science program where it was learning a lot. We also had group projects and also trying to apply for jobs. And I know it's easier. And also, I was still working full time, so I didn't have any free time. I know it's easier said than done, but you need to just create side projects if you can. And it doesn't have to be like huge project. Like it can even be a blog, because like what's data is not just like about numbers, it's about telling a story also. So even a blog, or you know how people have posts on Medium, just something where you can, like, especially when you go to apply for jobs, they like to see that, you're working on something, because you learn something. And how do you know you learned something? By teaching it to someone or presenting it and being able to do that on your own. So then that shows that you've learned. So it's, yeah, you learn all these things, but I feel like if you don't like try to recreate what you learned, you can kind of lose it. I mean, it kind of comes back when you're using it on the job, but then I would just say create something on the side, keep tracking what you're doing, you know, keep practicing. Easier said than done, but it'll be super helpful.
And there's lots of free data. Like if you go to data.gov, you can just pull a free data set and start working on something. So
Another question that I see in the chat is regarding the MPH, how would you recommend ways to include coding in any capstone or final project? Would it be a good idea to use Tableau for my research?
I did it on all my projects. I used Tableau, but I used R and SAS for both of my projects while I was in school. I just made sure to make a priority, even if my professor was kind of like, whatever. I was like, I need to know this to get a job. So just make sure you just include it, even if they try to deter you because they don't want to help you.
Yeah, I agree with Andrea. I wish if I could do one thing differently in my master's, we didn't have to learn how to code. But I knew in public health, I need to, now that I know how to code, I'm like, oh my gosh, this is so much easier than it was. I mean, I learned Excel like in an advanced level, but Excel is not sufficient sometimes for the, huge data sets that you're working with. So I would definitely recommend some sort of coding. Do you want to stay in public health? Do you want to move into tech? Do you want to move somewhere else? It doesn't really matter. I think it's going to be helpful. Totally recommend it. Like I said, if you learn like R, when it comes to Python, there's some similarities. So it'd be easier for you to, switch back and forth. I use Tableau all the time. I taught, it was easy to learn. I did get like in my master's program, they did introduce it. And then in my data science program too, it also helps with like organization, I think. And yeah, like Andrea said, I would use it even if it's not needed. It's gonna be really helpful in the end, and you're gonna be marketable. Because like I said, I did a project where they brought me in because they wanted visuals and they didn't have anyone to do it and they didn't know how to do it. And even if I have all these data analytics or data science background, that's the only thing I had to do. And so even if you won't get a role in specific thing you're interested in, sometimes that one skill you have will come in handy. So yeah, definitely use it for your research project, I would say.
So I don't see any more questions coming in. I definitely just want to end on the note that I want to point out that Andrea has her master's in epidemiology, but now she works in data science. And Barb has her master's in informatics, but now she's working in public health. And so, in terms of do I need a degree to do X, Y, and Z? I don't think it's the degree, so to speak. The degree helps, don't get me wrong, but it's being clear with what you want to accomplish, what do you want out of your career, and what are the sort of like necessary steps that you need to take to close those gaps, if you, whether it be a side project or an extra graduate certificate or anything of the matter. So yeah, definitely thank you guys for joining this session. Thank you to the presenters for taking the time out to share their knowledge with us.